Sam, this is Alyssa. You're doing good. I think we're ready to go.
All right. Well, we can get started here. Hello, everyone. Thank you for having me. My name is Sam Watson. I am the Academic Outreach Specialist at the Greater Midwest Region Office of the National Networks of Libraries of Medicine. By the sounds of it, it looks like Ohio is currently getting hit by the snowstorm that we experienced here. Um, the GMR office is in Iowa City, Iowa, but I live quite a few miles away to the southeast on the river, which put us right into the center of the storm where they threatened us with 10 inches of snow. I think we only received maybe 6 to 8, but the good news is it is a heavy wet snow that is rapidly dissipating and the road's already looking clear. So um, for the best, a little warmer weather this weekend, so maybe we can actually get to gardening outside. Um, that's my face there. I'm going to go ahead and, sorry, I'm going to turn off my video because I have notes I follow and I want to be kind of looking off screen here for you. So um, I'll join video back when I kind of get to the Q&A section here. But let's get started. And I believe Don sent out the slides for this presentation. So everything I'm talking about or contacting me, links, descriptions, and stuff I'm going over can all be found in the notes section of that PowerPoint. So feel free to reference that. Or again, if it didn't come through that way, feel free to contact me and I can send you the notes version of this as well. What I plan on doing here today is kind of giving you kind of a twofold, an update of what we're doing at the GMR office, particularly as we are going into our next year. We kind of follow an interesting fiscal year where we start at May 1st. So we're ending our year 4, going up to year 5. And so just kind of an update of where we're sitting at that transition. And then I'm going to talk about the services that we offer through the GMR and via the NNLM of our main services of training, funding, and outreach, and how that can hopefully support you as health science librarians there in Ohio. And then finally, the back half of this presentation will be about the new PubMed. Again, the slides included on this are trainer slides, so I'll show you where you can download those yourself, but you can use them. They have notes. There's even a short version of these slides if you are wanting them for your own use, or if you're instructing your users of PubMed at your organizations, your institutions, and how you can kind of get people prepared for the transition. Because I have this slideshow here, but it came to my attention just yesterday that if you go to the legacy version of PubMed at the moment, there's a bright yellow banner that says the transition is happening, I believe, mid-May is what they say, and I think the frequently asked questions say May 18th is the official day that the transition will happen. So try to address questions. I know you sent some to me ahead of time, so I'll try to intersperse this presentation with some of those questions. And again, if I don't address them, ask them away, or chime in or put them in the chat box, and I'll see if I can't get those answered. So I guess our biggest news in the GMR office, you may have heard that Liz Kiskaden, has moved on to new pastures. She's pursuing an opportunity at Creighton University in Omaha. She is, I believe, the library provost position there at Creighton University. And as a result, we have a new interim associate director, that is Derek Johnson. So you may have worked with him before. He has been with our office close to the beginning in 2016 here. He is the current interim associate director. He previously was our health professionals outreach specialist. So we have a number of different outreach specialists in our office. I'm kind of the academic and health science outreach. We have a public library outreach specialist, and then Derek fulfilled the health professionals outreach specialist role. He has a history of non-traditional library work. He worked as a solo nonprofit librarian, prospect researcher, and a competitive intelligence consultant. So he's had an interesting array of positions, but he does great work in this office, and so he seemed like a natural fit for the associate director position. So he is leading the way, and he kind of sent me this slide for another presentation he's done, and he's kind of following that mantra of what would Liz do, because he's using that as a good lead, because right as he got this new position, we all found ourselves working remotely. So it's kind of a trial by fire, but he's doing great work, and that's kind of the new leadership we're under at the moment. Um, and then going forward, again, with May being a new fiscal year for us, some things that we're going to be doing within the office, again, since Derek has taken on the new director or associate director position, we're going to be hiring another one-year term librarian position, again, kind of as a instructor specialist. That will just kind of be taking on some of the responsibilities that he's left behind with his new role. So we'll have kind of a new name and face in our office for a year at least. The thing with our funding at our office, they go in 5-year cycles. So year 5 is kind of the last one for our contract or our sub award for having our office at the University of Iowa. So that's going to be something we're going into the next year is preparing to reapply to office here at the University and then kind of carry that forward. We're also going to just be continuing our resource library and stakeholder focus groups relationships. I'll kind of go into details there in the outreach section of how that pertains to you as health science librarians. And then we're also going to continue to pursue the National Library of Medicine. They have kind of yearly initiatives and priorities that they kind of highlight each year. And so in the initiatives column, they're still following through with the All of Us. You may have kind of interacted with that. There's a public library focus with All of Us outreach, but they also, I know, work occasionally with health science libraries. There's an emphasis also on diversity, equity, and inclusion as an initiative, and also trying to make some inroads and good partnerships with public libraries in our region. And then priorities, we have a number of groups kind of working on these priorities within the NNLM on citizen science. I'll be talking about some of the training opportunities, but I believe we have a citizen science webinar happening at the end of this month, because I think April is the National Citizen Science Month. So we have a webinar focused on that. Data science is always an ongoing priority, but it's a particular one this year. So we offer courses on data science and just kind of how we can improve and market that. There's also a priority on HIV and AIDS. There's also one on making more connections with library and information science programs in our region. Again, I'm kind of spearheading that in our office, so I'll go in more detail with that in our outreach section. And then finally, the National Institutes of Health has a program called HEAL, which I had to look up because it's kind of a interesting acronym, but it is helping to end addiction long term is what that stands for. And it is just kind of a priority on opioid abuse and finding ways to kind of mitigate that throughout the country. So that's another priority this year. All right, so training, I'm sure and I hope that a lot of you have attended some of our online courses and webinars that we offer through the NNLM. This is kind of an interesting time, what with the pandemic and requirements of working from home. We're trying to step up and offer a lot more webinars, courses, more frequently, at least in the next couple months, because people are finding themselves at home, maybe finding the need to justify the work they're doing at home. So we're trying to maintain a healthy schedule of training opportunities on our course calendar. So I'm going to kind of highlight a couple of those because there's some coming up, but we also have a number of recorded webinars and also on-demand courses that you can kind of take asynchronously at your own pace. It's still worth MLA CE credit, but there's stuff out there that you can still do some learning, some professional development, even at home. Because again, we do a lot of remote work anyway, so it's transitioning well into this environment. So one thing I'd like to highlight here is our Kernel of Knowledge series. So this is specific to us at the GMR, but this is our expert speaker series that we offer here in the region. And we like to use this as an opportunity for experts in our region to kind of share their research or maybe projects that they have done, and just kind of as a means of giving them a platform and hopefully making connections within the presentations themselves. One that I just hosted last month in March was a benchmarking study of hospital libraries, and this was on research done by Elizabeth Momeau from Rochester, New York, I believe, Brooke Billman out of College of American Pathologies, and Angela Spencer of St. Louis University. And they did an hour-long talk about their recent research that they had composed on how there hasn't been a benchmarking survey since 2002 was the last MLA one, and hospital libraries have faced significant changes, including downsizing, position, and library elimination, as well as system and hospital mergers. So they kind of did a new survey, how hospital libraries are addressing staffing levels, the depth of services within their unique settings, and again, with that expanding health systems and the kind of conglomerations that are happening, how are people surviving within that? So that was a great kernel session. A lot of good conversation and connections were made there. So it is recorded and able to find that on our kind of course pages. You can search for Kernel of Knowledge and find the recordings of that there too. Earlier this week, we had another kernel on providing virtual programming in a health crisis. This was a kind of a public library focused webinar, but I thought it was maybe useful to, again, since everyone's kind of working remotely, showing how you can provide vital health programming to your patrons with minimal cost and without extensive technology that you may have at home. I'm currently on a 10-year-old computer and trying to make the best of it with my workload. So this was just a good kernel knowledge session, good advice on how to still be there for patrons and the communities that you serve. Again, we also offer on-demand courses. So just two here that I've highlighted. There's PubMed Essentials 2020, and this is made up of about 10 kind of really short video modules. They're, I think, around 2 to 3 minutes each, and they have interactive exercises built into each module, so you can kind of explore PubMed at your own pace. And I believe this is updated for the new PubMed, so kind of good practice for what the new look is like and the feel of it there. And another one that we offer for on-demand is there, I think, are 3 different on-demand courses on serving diverse communities. And this series focuses on accessing health information resources related to working with diverse communities and underserved populations in your community. So again, these are just good resources if you're looking for continuing professional development. There's a lot of MLA CE attached to these courses, so it's a good way to kind of give you something to do, especially if working remotely and needing kind of those opportunities. They are still available. I'm going to kind of jump here to our calendar. So this is the NNLM course page. See if I can do this. But you can see that we are offering a lot of courses down the line here. A lot of these here, I believe, are full or currently happening, but you can kind of see other ones that are coming up. We have clinicaltrials.gov, results reporting unique evidence in the role of the medical librarians. There's the citizen science one there, putting kind of a self-care within. And another one that I'm going to be hosting here in just a couple weeks is getting started with information outreach in your community. And this is kind of just like an introductory course, or just a 1-hour webinar of how to think about cultural competency and outreach skills that you can use as librarians to reach those underserved and underrepresented minority populations in your community. And it's kind of offers some concrete ideas that to initiate outreach programs in your community with those populations. So it's just kind of a fun short webinar I like to host. And also upcoming too, we've just announced these, I think, last week. We have an ongoing PubMed series of courses, previously known as PubMed for Librarians. It is now known as How PubMed Works. And it's just a series of 4 classes that they've been pretty popular. We had one last month with full registration, I think due to maybe the new changes to the new PubMed. And we had one in June scheduled as well that I think was quickly filling up. But again, with the need for remote programming here at this time. We've also started another one of the series starting in May, and it's going to be, as opposed to once a week, there's going to be 2 a week. I teach the medical subject heading on May the 12th, but they're very useful. They've been updated to, again, include the new PubMed and how it works with each of those categories of how PubMed works. But last I checked earlier this week, registration is still available for all 4 of those. So feel free to sign up and register and take part, because again, I'm going to try to answer some PubMed questions here, but it's a great place to ask maybe those specific advanced searching options with the new PubMed, because we'll have some generally good power users that attend these courses as well as panelists, so they can answer your questions within that. All right, that's kind of training opportunities. Something else that we do through the GMR, which maybe some of you have taken part of, is funding opportunities. So just kind of highlighting where we're sitting at currently in the upcoming year, and what funding opportunities there are going to be on just available throughout the year as well. So we had kind of a early award announcement. So the awards that we fund for our upcoming year starting in May, we did an announcement actually back in December to start accepting applications. So at this point, we had received up to 28 applicants. After kind of the evaluation process, we have whittled it down to 9 awards. So 8 of those have received our Information Outreach Award, and 1 of those has received our kind of data focused award, and those will begin on May 1st. And so those projects are going to start May 1st and go to the end of April of next year. And that's kind of our largest funding mechanism, in that if there are any sort of outreach projects that you're hoping to do with kind of a health information focus on it, reach out to us, because we can see about how that can be molded into a good application for when we announce these yearly. And we can kind of keep you informed as to when the applications are currently available. But again, there is funding available throughout the year. Another one highlighted here on the screen is the Expert Speaker Award. So you guys previously were watching Elizabeth there give information on the surveys, I believe. And that is something that we at the GMR office funded. So there are ways to, if you're holding more of these association meetings, or if you're part of other groups, or just within your own library institutions, if you're trying to host more of these to bring in expert speakers, we offer awards up to $2,500, which was intended for kind of travel and accommodations, but possibly could also be used for honorariums, or just kind of incentivizing speakers to come and speak at your meetings or your institutions. So again, you'll find the link in the notes of the slides here, but you can find that on our GMR page, and it's, I wouldn't say utilized as often as I would imagine. So there's usually funds in this award throughout the year. One that I didn't highlight on here, but we offer on an ongoing basis too, is we can fund the MLA holds monthly webinars, and we can fund codes to watch those webinars, again, kind of on an institutional basis. So if your library likes the look of an upcoming MLA webinar, you can find funding for that on our page, and I'm kind of in charge of making sure that we get those sponsored. And again, you get up to 25 codes for the MLA CE credit, and good to, for up to 6 months to do them. So you don't have to watch the live version. And I think we've even found the ability to let you share those codes too, because your institution may not need 25 codes, but you can also share that within our region and your state if other librarians want to take advantage of that. So another way.
Sam,
Yeah.
there was a question Megan was asking, kind of what you were just talking about. Is there any chance these would be recorded and made available? She's talking about the How PubMed Works series.
I believe the last months were recorded. So they are going to be recorded and posted. I believe the logistical holdup was going to be just like the captioning that they do post and editing. So again, if you go to the How PubMed Works page, there should be eventually the recorded broadcasts of those from last month. And yes, they are looking to make that available. And there's also been talk of kind of making some of that information, recording them and putting them in like a Moodle class as well, so that people can access later too. So keep checking that How PubMed Works page. I, our group
Okay,
kind of meets.
really, I posted, I think, the link. Megan, are you able to see what you were looking for on that link that Marilia just posted?
Everything okay then?
Yeah, we might want to touch base with Megan at the end just to see if the link that Marilia sent her was what she was looking for.
Okay. Yeah, and I can send those out with a kind of a question part, and I can utilize the chat box a little better.
Yeah, so I'm on that page, and it clearly states there are no archived sessions,
right,
archived recordings of this class.
And that's where they will be once
Okay.
they do get, again, last I was told they were still being captioned. I'm not sure if they needs to go through some sort of 508 compliance too before, since it's kind of a nationally funded organization, that there's some hurdles I know they have to do before they can post it, but I've been told that they will be available in that section once there are two.
Okay, thank you.
Yeah, you're welcome. And so speaking of kind of the funded projects that we offer, I like to just kind of highlight two that are specifically coming out of Ohio. Again, this one is just coming to close here, but at Wright State University, this year we funded a high school education day for substance abuse prevention. And this was with, I believe, Sue Palanca out of Wright State University had created this project in which they were bringing in underrepresented high school students to their library to have kind of a day-long education day for substance abuse prevention. So the library had a module on, I believe, evaluating information, health information online. They also partnered with the School of Medicine at Wright State to do a module, and I believe the School of Education. So they each kind of focused on a different kind of element of educating students on substance abuse prevention. And the larger goal was to kind of have the students create a poster or maybe even a paper of kind of what they've learned and kind of give it a final project in that sense. I know that the pandemic may have affected that in some way, but that is some funding that we did, that they were able to partner with different organizations within their university to kind of put this on. And again, if you look at the slides, there's a neat little YouTube video kind of showing what they were able to accomplish with this day last fall. And then another one that we're funding with Richland Public Health out of, I think, Mansfield, Ohio. They have kind of some ongoing funding that they've received, and next year we're going to be funding them on a research data award is what they received. And what that is maintenance and training for county level FAIR initiatives. So with FAIR, data makes it findable, accessible, interoperable, and reusable. What they've done is created kind of local community health information and compiled it into this online tool that then can be utilized by hospitals, the community in some way to generally improve public health. So what they're doing with this funding now into the next year is to kind of offer some train the trainer sessions for, I believe their target was rural north central Ohio counties, I guess in an effort to improve public health, and they found a way to kind of compile the freely available health data that is out there and just make it a more useful and usable tool. So these are just kind of two examples of projects that we fund yearly. And again, if you're thinking of something you wanted to try to put on, you can reach out to me I'm happy to look over proposals, help you give it advice on our awards process. We don't even refer to them as grants because we try to make it as painless as possible to apply. So again, any ideas, feel free to reach out to me and we can see what we can help you with. All right, and then kind of our final service that we offer at the GMR is outreach, while maintaining that 6-foot distance. We can kind of talk about what we try to do to support you as health science and academic librarians in our region. We want to constantly communicate with you, especially with this transition of the new PubMed, of the updates that are coming from the National Library of Medicine. And one way to kind of keep you the most up to date, I like to highlight the National Library of Medicine's technical bulletin. This is kind of their I'd say online magazine, but the site that they update like each month, where you're going to find kind of the official announcements of new changes to PubMed, or just new API stuff, or new National Library of Medicine announcements. It's a great place to kind of keep up to date on those changes. Through specifically us, the GMR, you may have subscribed to some of our newsletters. We have a general digest that comes out of our office that kind of covers a little of everything happening in our region related to us, the GMR. But you can also do area-specific ones. So I do a monthly one called Health Highlights that's pictured there. That's geared specifically to academic and health science librarians. Again, I try to highlight upcoming webinars and courses that I think would be most relevant to that group. The ongoing funding that we're offering. The past couple months, I've just been highlighting the new features that are happening in PubMed as they're approaching that transition. And again, I'll occasionally put in some, new health science librarian positions that may be in there, may have missed. And if I do have any leftover ones, those MLA webinars that we can get codes for, sometimes we'll have excess codes, and we will put those into the newsletters for people to use at their leisure. So kind of a good way to keep informed and keep focused to kind of your area too. And if you work with public libraries or public health workers, there's also newsletters dedicated to those groups too.
Sam, there was a question about, is there a mailing list when Health Highlights comes out, or can it be automatically sent to your email?
Yes. So again, if you've got the slides, it's in the notes there. You can go to the communications page on the NNLM GMR, and you can sign up for the newsletter there. And then, yeah, you can kind of choose which newsletter you would like, public libraries, this academic and health science library one, or the public health. And yeah, it'll go right to your email. And again, I try to send it out usually the 3rd or 4th week of the month is kind of when I send these out. And then the final thing that we also do with outreach is I also am in charge of the Health Science Library Advisory Group. I was optimistic in thinking I was going to get one more group meeting in before the end of our year at April, but this kind of work from home thing pushed it back just a little bit. So I may try to convene this advisory group maybe at the end of May, but this is where we have representatives from each state in our 10-state region. Just to kind of, again, we do some of this GMR updates, try to take questions and concerns from the group too as representatives for each state, and then they can kind of share the information that I'm providing too. So that's something we do about 2 or 3 times a year, and I'm gearing up to do that again too. So I believe we may have a representative here today, but yeah, that's going to be coming up down the line as well. And then with outreach looking forward, again, thinking back to some of those priorities that the National Library of Medicine had, one was partnering with library and information science programs. And I have a couple things that I've been working on. One is the Medical Library Association has a research training institute, and they're looking to maybe send library science students to health science libraries to learn more about kind of like data librarian profession in as it's happening at these organizations. So it's almost like an internship or a fellowship of some sort. So what we at the GMR are looking to see if we can kind of fund those internships, those fellowships that they're going to be creating. So I'm pulling together kind of competencies that these institutions might be looking for in students who want to become data librarians, and then we're going to be offering the funding to let students attend these actual locations. So my hopes is to have this done in the summer so that, when students are hopefully going back to school in fall, that they can take advantage of this, and we can help to kind of fund these students, because we're hoping to get more library science students into the pipeline and think of health science librarianship as a viable career option. And a second program that I attempted to do this year as well is the Alternative Spring Break project. I was working with the University of Kentucky, who kind of has a yearly program with this, where they send their library science students to the National Library of Medicine or the National Archives, kind of work on week-long projects, gives them some practical experience, an opportunity to see these organizations, these institutions get tours, kind of network with some of the people there. And so we were going to attempt to do that too and have students go to one of our NNLM offices. We had one student that was going to go there, but again, the pandemic had other options for us on that. So I'm going to continue this going forward, but this is something that we're looking to kind of fund and support. So I'm trying to think of Kent State. Are there any other programs besides Kent State that has a library science program in Ohio? But I'm kind of getting them feelers out there to see if they do this and to see if we can either have students come to our office to work on projects or even fund students to maybe go to health science libraries out, in the world and kind of take part in like a week-long project. And again, gain some practical experiences and see the profession firsthand. So if that's something you're interested in, feel free to reach out to me and I can see kind of build something with that.
Sam, Judy has a question. Would these opportunities ever be open to graduates, people who have already finished library school?
I don't. Possibly. I guess we could maybe. Again, we don't have all the parameters in place yet, but we could see about opportunity, like recent graduates in a sense could maybe take part in these. I think we just started with the alternative spring break at programs themselves because of a lot of those that do offer it kind of attach credit to it, but I don't see why we couldn't have graduates be able to take part in this as well. We're still kind of fiddling with the funding we can offer. Again, when we were working with University of Kentucky, they offered their students like $1,000 stipends to go to the various locations, and we were going to offer like an additional maybe 500. But depending on how big I build this project and how many students want to take part, that could almost limit how much we can offer with funding. But again, that could definitely be a viable option, and I'm still building it, so it seems like a good idea to me. I'll just kind of have to investigate further to see if there's any restrictions with something like that.
Thank you.
Yeah, thank you. So then finally, kind of just with general coronavirus updates, our messaging has been just, again, you've probably seen on some of our NNLM pages, is to go to the primary sources with this. So the CDC through coronavirus.gov, also through the National Institutes of Health, so nih.gov/coronavirus. And then kind of pictured here is the National Library of Medicine's homepage. They've got a whole banner and section specifically dedicated to resources and disease information on COVID-19 on their homepage there. So questions and concerns about that or just resources, again, this is kind of where we are directing people at this time.
Sam, I had a question. Are there any, I can look at this, but do you know if there's any like mental health resources related to coronavirus?
Not off the top of my head, but that doesn't mean they don't exist. So that is something I can look for you after this and see if I can find anything. All right, so that's kind of, again, an update of where our office is and where we're headed. Again, chime in with any questions here too, but I'm going to kind of go shift into the PubMed update part of this. Again, the slides that I'm going to be using are available to you as health science librarians. I'm going to kind of show you the site that you can get there. This is the new PubMed Trainers Toolkit. It's kind of got a long URL there, so if you just Google PubMed Trainers Toolkit, it'll get it right here. But you're going to find a lot of useful information here. There are slide decks. Again, I'm going to be using the full version here, but there is a brief version of these slides, and as well as kind of a introduction to PubMed for those who maybe unfamiliar with the database. But there's other useful things here too, like a handout, a 2-page handout on tips for using PubMed. There are also tours. So these are all going to be quick, it looks like 1 to 2 minute videos on, how to find articles in PubMed, how to find articles from a citation, a lot of different things that you can also utilize for LibGuides. Also, if you have learning management systems that you are incorporating some of these, we also have the same tours available for SCORM packages so that they can just kind of be grabbed and installed real quick and take part of course management systems you may already be using. There's also a training the trainer session. There's a webinar series. Oh yeah, that's our How PubMed Works series class, and kind of a health highlights one that happened just last November as well. So I'd like to point this out because it's a great resource for getting people acquainted with the new PubMed and resources available to you. So again, I'm talking about this. Again, you can utilize these slides in any way you see fit. So this was created by the National Center of Biotechnology and Information, so the NCBI, as well as our Office of Engagement and Training. You can freely use these slides. There's no copyright restrictions with these, and they would just kind of appreciate an attribution. So this is coming from the U.S. National Library of Medicine. It's kind of the recommendation with this. Again, they try to keep these updated. The slides were last done, as you can see, from March 2020, but they'll keep you updated as to if any changes occur. They'll try to keep these in the slides and on that trainer's toolkit. Again, I'll highlight that NNLM's technical bulletin as a great kind of up-to-date resource that'll inform you of new changes. So, with transforming the new PubMed, they're doing it into a modern hub with fast, reliable, and intuitive search that connects people to the world's leading sources of biomedical information. So this is kind of a new mission statement. It's a result between the NCBI, library operations, so they're the responsible ones for Medline journal selection and indexing, and the National Library of Medicine leadership. The modernization of PubMed goes well beyond this interface. They're moving kind of PubMed to the cloud, kind of rebuilding the entire infrastructure with it. So this system was built in an agile development environment. So they're incorporating user feedback, usability tests, and analytics every step of the way. So they're trying to involve researchers, librarians, clinicians, patient health advocates, and others. So they're trying to build it iteratively, and they're trying to integrate user feedback into the design. And as I'll kind of show you on PubMed, there is a feedback button in the bottom right of every page. So feel free to use that if you have questions or concerns about the new PubMed. But you can also reach out to us and me specifically at the GMR office, because we're kind of trying to be a conduit, because there's a lot of questions as these changes arise, and we want to try to get them answered and people happy with the new changes. So if you want to try to reach out to a specific person like me, as opposed to kind of a void that can be kind of a comment feedback email, feel free to reach out to me as well. So again, the new PubMed includes features that you're currently relying on, and the slide is kind of it's trying to update as I'm doing a presentation. Sorry here. Okay, are you still seeing the slides?
Yes, we can see them, Sam.
Okay, sorry, my computer tried to update in the middle of this.
We're on the features you rely on.
Features you rely on. Okay, great. This is just kind of a selection of kind of the ones that they've heard the most concerns about. They want to reassure that the features and functions from the old system are going to be available in the new one, maybe in a different location, maybe with a different look. But we're going to kind of review some of these with particular interest coming up as we go along. So in addition to the features you've come to rely on, the new PubMed includes great display and navigation and output improvements. It's got a cleaner look. I'm sure you've kind of used it. It's a little more intuitive. It's hopefully a little more easy to use. And again, we're going to kind of be talking about each of these as we go up. But there's new snippets in the abstracts. You can jump from abstract to abstract from each page from your results. cite in your preferred format. All these are pretty useful here going ahead. There's a note here that about half of PubMed's traffic is coming from mobile devices. So they kind of wanted to create a truly responsive site that can meet the needs of those mobile users. And that's including the ability to link from a mobile device to library subscriptions via outside tool. And I believe that was a question. Somebody had sent a question earlier about if you are able to kind of use those outside tool icons and links when sending these in emails. I just heard back this morning actually, from them on that one. That feature is not currently available, but it is going to be coming in the future. So it is happening. Like again, they're making sure everything is getting transferred over. It's not there immediately, but it will be available in the future. They've also been able to apply new retrieval features in this new PubMed, so they've got improved, and they will continue to improve the citation and other sensors. They have an enhanced synonymy that's including plural form. We'll kind of see some examples coming up. They've improved the British and American mapping with the automatic term mapping that occurs, and they've also removed limits on the truncation. I think they had a limit of 600, 500 previously, and now it's kind of unlimited at this point. So, and the best match sorting algorithm is going to bring the most relevant results to the top of your search results now with this list. So to find articles by topic, you want to enter your words or phrases into the search box without quotation marks or any of the fancy syntax that may be used. So again, it can be something as simple as treatment to incidental adenocarcinoma or preventing head lice in schools. And it just kind of wants you to let PubMed term mapping, and it's always improving the retrieval algorithms to do the work for you. So your best matches will always try to be at the top of the results list. And they have a note that you can check the term mapping by viewing your search details in the advanced screen. Again, I'll kind of show you this in the future, but you can see what it's mapping to in your search details box there. And again, if it's failing to map to your medical search terms to mesh, the recommendation is to try synonyms for concepts for better results. Again, other things that haven't changed: to find articles by citation, you enter the citation elements you have, that's author, title, words, journal, volume, year, and you're just going to let PubMed citation sensor find the article for you. Find articles by author, you're going to be searching the author's last name and initials like before. And to find articles by journal, you're just going to use the complete journal title, the ISSN, or the title abbreviation. And so the timing on this, again, with the news as of yesterday, we've kind of can update this, but they formally announced it in November. Spring is when the new PubMed is going to be default. Again, I believe if FAQ is any indication, it's going to be May 18th that the new PubMed will be the default on the site. But both of these are going to be running in tandem and concurrently. For the slide says here several months. When I was looking at the FAQ before this, they have language that uses a short time, which is a little vague. We still don't have a specific date, but I'm going to go based off of what this slide is here saying, is that they will both run in parallel for several months, but eventually the idea is to retire the legacy PubMed after that. Again, they want to reassure you that they're continuing to improve it and make sure that all of the features that came from legacy PubMed is being put into the new one. So I don't have a specific legacy PubMed is coming to an end at this date, but hopefully that will keep us abreast of the changes, and we will share that with you as we learn them ourselves. So at the time that the new system will become default next month, all links to PubMed will redirect to the new system. So that includes all of the associated tools built for PubMed searching. That includes the MESH database, the National Library of Medicine catalog, clinical queries, single citation manager, and the batch citation manager. Sorry, I'm messing up my words here. The single citation matcher and the batch citation matcher will be linked to the new one. The My NCBI will also redirect to the new PubMed. So that means all your saved searches and alerts are going to function. You don't need to do anything to prepare with that. And at a future date, they're going to release the new PubMed API, which at this point is still under the development stages. Again, they want to ensure that they'll continue to improve it based on your use and user feedback too. So let them know if you have questions or concerns.
Sam, Megan had a question, but I think you might have answered it.
Sure.
Megan, did your question get answered? All right, thank you. She did.
Okay. So I'm just kind of talking about it. Again, they have the slides kind of walking you through. They also recommend you kind of just see it in action too, so we can kind of jump into the new PubMed. Hopefully you've had an opportunity to try it yourself. So let's kind of take a look at some of these, and we can just start with a known item search. So we can try showing off the improving citation sensor. So we can do like an author, a journal, and a publication date. So they've got Medicine 2016. Again, just kind of easy terms here, and they're going to have right there one article found by citation matching. They're going to continually improve this to improve the citation matcher and citation elements. They're all going to be listed here with the most likely record here at the top. And as we click this, then we can kind of see the new features that you're going to be seeing within the new PubMed here. So things you'd like to look at here on the sidebar, you've got your links to full text, including up to 5 outside tool icons that will be here. Again, it's to bring you and your patrons to your institution's online subscriptions. There's also quick ways to save the citation information. You've got this handy new cite button, which I'll show you in the moment. And then you also have a favorites. So I believe I'm currently logged onto this, but if I click favorites, it's going to move it right to my my NCBI favorites section. Which saves the citation there. They also have shareable options. So we've got the permalink as well as easy ability to share our citations through Facebook and Twitter. And then there's also a quick page navigation so that you can kind of jump to the references or mesh terms that as opposed to having to scroll all the way down to the bottom of the page. So if we go back up to the cite button, this is kind of the new feature that I believe was only available previously in PubMed Central, but they moved it over to the new PubMed. Again, it allows you to easily generate a properly styled citation. There are 4 different formats. You've got AMA, MLA, APA, and NNLM citation format. You can also quickly copy it here by clicking there, and as well as the standard citation format. So this NBIB format, which is kind of used widely by reference management software. Back to our home page here.
Sam, there's a question from Hannah. I'm sorry. She's just telling us what she's doing. Sorry about that.
Okay, that's all right.
Now, I did. Somebody had mentioned one of the formats for reference management software they couldn't find, and I can't remember which format it was that they said was not available anymore. Have you heard about that?
Is this of this group here, or is this kind of a broader question that may have been like an?
It was something that I didn't get a chance to send you. A question actually that I had. I think it was like one of the common formats that works across the different reference managers. I don't know if it was like NBIB, or it was one of those that they were shocked that it wasn't there anymore.
Well, because I think it used to be like RIS, I think was the old one, and then I think they've updated it now to be the NBIB, which is I've been told is kind of what maybe Medline uses, or it's an older format that has been around that is kind of still is in that it used to be RIS, and now I think it's NBIB. So I think it's supposed to serve the same function, but I can ask around and see if I can get more into the weeds with that.
Yeah, I had seen somebody was I don't know. Can RefWorks use NBIB?
I do not know that off the top of my head, but again, I can look that one up too.
Okay, Jimena says yes, it can. Okay.
Yes, they can. Okay. All right. Yeah, because I've been told that it was attached to the old Medline in some capacity to try to be as universal as possible.
Okay, great. Thank you.
Again, to try to reinforce that searching works the same way as it did in Legacy PubMed, we can try a subject search here. So they have otitis treatment. And again, as you can kind of see here, they're striving for a cleaner and easier to use results page, while still maintaining that full functionality that you would find with the legacy PubMed. So just to kind of highlight some of those features, you have the results by year. You can click and drag these circles here to kind of confine your search. It has a nice way to expand it to kind of give you a little more granular detail to adjust that. You've got the export options here at the top, so ways to kind of copy the PubMed records to other places. So we've got save, email, and send to. Again, we'll kind of go in these in detail here in just a bit. But you can also see the snippets from the abstracts here. Again, this one doesn't have one, but gives you a little kind of preview of what you're going to find in the abstracts on this one.
Sam, Mary Pat asks, is there any way to display all the abstract rather than just a portion?
Not that I know of off the top of my head. At least not with the features that I have here. I think we could switch the best match to include the abstract, but that's going to make your page quite a bit bigger. So yeah, there you'd have the full thing within it if you switch from best match to abstract. But I believe that's the only option at this point.
Sam,
Yeah.
Anna asks, do they indicate anywhere which versions of the different styles they are following with the automatic formatted citations? I believe that both APA and AMA were updated recently.
Yes. I think, sorry, I'm going to open another document here. I think we had a question earlier. Is APA like on the 7th? Is that? I don't know them very well off the top of my head, but last I heard, I thought maybe APA's was 7, but that is something I can get more details for you on. So 7, yeah, that's the number I've heard, but I'll have to dig into my paperwork to find out for sure on that, but I can send that out to you too.
Okay. I'll send you the list of all the questions here as a chat transcript so you can have that and who asked.
Yeah.
Yes. We also have a question from Liz. Do you know if there is a rush to switch over to the new PubMed? I know some people are concerned about this being a stressful time with COVID-19, and having our users switching to a brand new platform might be too stressful and or a barrier to finding information they need. And I had seen that on the Twitterverse also under MedLibs.
Yes.
People kind of saying, is this really the best time to switch it over?
Yes, I have seen those concerns. The best I can offer is the messaging that has been imparted to us is that the idea is that they are moving forward. They want people to get acquainted with the new PubMed. This would just be speculation on my part. I think going forward, if there are still concerns about the changes, they may expand the period in which both of them are running concurrently. Again, to kind of let people adjust to those changes again in this time of working more remote and adding kind of new learning to the process. But again, I had asked this question too just yesterday when they gave the final transition date and with that language of short time. And yes, that is the response I received is that, and they're moving forward. Again, this is a rough time, but I know they've been working on this transition for over a year at least. The original time was to do it last fall, I know, but again, I can't give you definitives, but educated guesses as to that would be is that they would keep them both going for probably a little bit longer than they had previously scheduled to account for this, but they'll still encourage people to use the new one and bring over those features from the legacy PubMed in an effort to.
All right, thank you. Another question from Ginny. It doesn't look like it's using dynamic URLs. Is it possible to send the link to a particular search to a patron and not have it expire?
So like a permalink feature?
I think, Ginny, is that what you were asking? She says sort of.
Sort of. So like this, because again, with under the share options here, they've got the permalink that should give you the reliable source that will get them to that citation. Is that not?
Ginny, do you want to unmute yourself and just ask him directly?
Yeah, thanks. I can elaborate. So I'm thinking sort of like EBSCO searches. EBSCO is one is what we use for our EDS system. It requires, if you want to share the entire search results, that you have to have a particular permalink. And the same thing for any articles. The URLs are dynamic and break after a certain amount of time. It doesn't look like this is the same case with PubMed. So if I for example, we're trying to, they're on chat with a patron and they were looking for particular, looking for some articles. Could I send them that URL with the entire search results page and then not have it break on them?
I believe so. So like, again, kind of as we're going through this, I think you can do, they have the clipboard feature. I'm going to jump ahead here on my presentation. You can export the records for, reference management software. The save feature, you can, again, if you're wanting to email someone the results list, you can do it with by manually selecting each one, and then, oh wait, this isn't it, sorry. Sorry, I have to say that the caveat is I am not a power user of PubMed, so I can find answers for these as well. But again, from what I understand, that you can kind of keep the permalink there and saving your searches to share with others.
Jenny, this is Alyssa. Do you see the link in the chat? Does that work for anyone?
Yes, it works for me, but no results were found.
I think that might actually be the case.
Okay, then yes, it seems like it might work.
That was just the current thing that I had in my browser, and I think the answer was that's a brand new abstract, like came out this morning. Cool.
So I'm sorry, is that working or is it not working? I didn't catch that.
It does seem to be working, yes.
It does. Okay, all right.
I went into the advanced view, like right above. Yep.
Advanced searching. Mm-hmm.
And then I went down to look what I had done and looked in the details for each one.
Details, right.
And then I think I clicked on the results set where it says 18703 or whatever and copied that link.
Oh, and just this link here.
Yep.
Okay. Well, I can do some more exploring on that to see if I can get a more definitive answer for that, Anya. Let's see. Sorry, were there any more questions too? Yeah, keep them coming. Okay, so again, what you're finding on the kind of results page, you still have your filters here. The most popular ones there. You can add additional filters as needed to appear on the side. And I'm currently signed into my NCBI, so you can have your own specific filters. A quick use there at the top. And you may have seen this feature too they like to show off is the next results, which again, if there's kind of a little brief snippet, kind of tells you what the next one is. And you can quickly hover over it and get a highlight of where you are in your results list. Again, they say that using the save, email, and send should work familiar like it does in the legacy PubMed. So to export records to your reference management software. So again, if we want to choose some of these, use the send to file, and again, citation manager. It lets you know to do all the results on this page, all results in total, and or just the two that I've selected. And it's going to create a file again like the NBIB. I'm trying to think if we had a question. We may have received a question about sending all the results. There may be, I think there's a limit on these, which we'll get into details here further. The email options are also, should be familiar from legacy PubMed. Again, you can just type who, subject, the body, again, based on your selections or the results on the page and the format you want to send that to them in. Again, with the send to option, again, you can do a clipboard, and the clipboard allows you to use up to 500 citations that can be temporarily saved to that clipboard. You can also save to your My Bibliography if you're logged into the My NCBI. You can add up to 1,000 citations to a collection in your My NCBI account. And you can also export citations, like I said, through the citation manager. The NBib file is what they'll offer you there. So they're going up above here too. We'll get into the advanced search, which we kind of saw earlier, but you can create alerts. Again, this should work like it did before. The name of the saved search, the search terms, and the frequency with which you want to receive it. All that should be the same there. But yeah, let's go into advanced search. Again, they tried to increase the robust functionality of it, and including the ability to show the complete indexes for searchable fields. So it's not a new feature, but got some automatic complete for some of these. So if you're, say, doing Collins and are looking for a particular author, there's kind of some autocomplete features for author, and journal indexes is the other one. If you want to know the name variations searchable in PubMed, or possibly need help finding the complete journal title, this advanced search page is the place to go for that. Again, we saw some of the search history there where you can kind of get the full details by clicking this caret. This is going to show all of your search term translations. This is going to include the improvements that they've added to the new system. So some of those, like, and a common question that comes up with these is whether you can edit these search details box. And in order to do that, you've kind of got to do the copy, paste, then you can kind of edit it within the query box here, but that's the way to edit the specific query. Okay, so I'm going to jump back into the presentation and jump ahead on the slides. So the new retrieval features that they have in new PubMed, they've got improved sensors. Again, we talked about enhanced synonymy, including plural forms, enhanced British and American mapping, and unlimited truncation. I think that's a question I received earlier, was the automatic term mapping feature. Again, is going to kind of do all these things for you, especially with the unlimited truncation expanding to from I think 500 to 600 to including everything. In addition to the automatic term mapping to mesh, the new PubMed includes additional useful synonymy. So this includes plural forms. So again, searching for lunch, as you can see here, they did lunches and lunching automatically with the term mapping. The new PubMed system also comes with improved mapping between that British and American spelling. So you don't have to worry about including that in your search. It just does it automatically, as you can kind of see on this example with anesthesia. Again, here's kind of the truncation in action, searching for Catal, and you can see how many more results were included from PubMed Legacy to the new PubMed and the unlimited truncation. And again, this is a new PubMed built from the ground up from mobile foundationally. So it's offering full functionality for all of the features you're going to be finding on a desktop version. And so if there's no app, they can just go to the website, and a lot of the features that I was showing you here on the desktop are also going to be available in the mobile version. That's a tablet or a smartphone. So again, here's some of the key points that we kind of went over. I won't kind of bore you with all these again, but they're just looking to continually improve it, and definitely use that feedback button as you're using the new PubMed. Got some questions here. I'm going to get you answers as well, but feel free to reach out to me with more so that I can get answers to you. Again, I'm part of newly part of the PubMed working group that they have through the NNLM. So they meet weekly, every other week, and that would be a good time to kind of address some of the questions that you may have to the changes made. Again, if you're looking to stay updated beyond us, that technical bulletin is a great place for updates that they're making to the system. There's an NCBI Insights blog, new PubMed homepage too. Will kind of give you updates on things that are happening. They're trying to be more aware on social media, on Twitter, and having a presence there. And again, through the NNLM, we're offering training with how PubMed works. Again, there's classes available for May that we can kind of answer your questions to in a live setting with kind of some experts of using PubMed there. So I've kind of reached the end here. Sorry, I hope I haven't gone over too much. But is there anything else I can try to answer for you at this moment, or write down and do some research post-presentation?